Thank you very much, and welcome to this second in a series on Elsevier Thought Leadership Series. This is the future of healthcare and evolution of healthcare in crisis. This is our second presentation today and second opportunity to meet one of the thought leaders across the globe. We had the pleasure yesterday of meeting with Dr. Xiong, and today we're going to be with Dr. Benjamin. Professor Benjamin, which is a really exciting opportunity to start to look at innovation as we go through this series as well. And really what we're very interested in understanding is how healthcare is changing following the challenges really of the COVID-19 crisis. We're here on Zoom. We are meeting across the globe on a daily basis. Normally, I would be sharing an opportunity to travel the world and meet with people. So this has been a challenging time for all of us. And we've got lots to learn from across the globe. We saw yesterday how differences in managing healthcare within Hong Kong with the massive data capture supported really the management of the track and trace of patients within the COVID crisis. So we're learning as we go, and we're learning from other countries, and therefore it's fantastic we can share that. A little bit about this session: we want you to give us questions on the Q&A tab, which you'll find at the bottom of the screen. Welcome those questions. I will be reading out some of those questions and posing those later. So really, introductions. Dr. Benjamin, do an introduction there. He's consultant physician rheumatologist who's attached to the Pantai Hospital, Kuala Lumpur, Park City Medical Centre, IMU Medical Clinics as well. He has a special interest in healthcare IT and leads the Hacking Healthcare movement. In Kuala Lumpur, he is president of the Arthritis Foundation Malaysia and is immediate past president of the Malaysian SLE Association, and has founded Medicine Malaysia website as well. Part of the Targeted Ultrasound Initiative Committee of the Malaysian Society of Rheumatology. So I'd really like to welcome him to this webinar, give him an opportunity to talk a little bit about unlocking the power of innovation in healthcare. And I'll hand over to you now, Dr. Benjamin.
All right, thank you very much, Tim, and thank you, Elsevier, for having me today, and welcome everyone spending your evening and for attending the multitude of webinars that has been happening around the world. As I speak, for the first time, the Europeans and the rheumatologists in Europe are having their e-congress for the very first time, because it was supposed to be held in Germany, Frankfurt, and that is obviously not possible at this time. So I think we have to talk about, so when we say unlock the power of innovation, let me say that there are a lot of uncertainties still. There will be a lot of conversations going, but the elephant in the room obviously is this COVID-19, and it has resulted in a lot of rush to change the way we do things as we delve into a little bit of unknowns in terms of how long this COVID-19 will last, and whether we were going to have a third wave or even subsequent pandemics later on. But clearly we do know that there will be more pandemics in the future, and this will certainly not be the last. And I think COVID-19 offers us an opportunity to actually change the way we do things. And we all agree that healthcare needs to change and innovate. However, it's always easier said than done. Certainly, there are a lot of players within healthcare. There are a lot of regulations. And on top of that, it's a lot of physician involvement, patient involvement, as well as involvement of the organizations, the governments, the medical schools. Everyone has to play a role if we are to change the way we deliver healthcare to the general public. So there are a lot of issues with healthcare. Next slide. And I think it's important to talk about some of the existing issues into why healthcare has been a little bit slow in embracing technologies as opposed to some of the other fields, for example, banking. That has certainly changed by leaps and bounds, and we can't. A lot of us cannot remember the last time we went to the bank with our bank book to withdraw money. Similarly, the aviation industry as well has gone on by leaps and bounds. And one of the main reasons it's because healthcare it's still generally very fragmented and siloed in all sense of the word, whether it's within hospitals or whether it's between hospitals or whether it's between the private and the public sectors. And certainly data sharing is still an issue at this time. And therefore, there is a lot of difficulties even for startups or for companies to come in and formulate a solution for healthcare. And this is something that we will have to change. Secondly, it's certainly very tightly regulated. And as a result, there is a lot of bureaucratic processes. And some of these processes take ages to get through if you're lucky. So I think that has to change as well in terms of how regulations are seen and how efficient we should organize these regulations and remove unnecessary measures. And therefore, a lot of processes are inefficient. One of the things is, for example, we have been involved in clinical trials. If you have seen how clinical trials are done these days, you will understand why it is extremely expensive. It is extremely wasteful sometimes and highly inefficient. The repetition of work that is done, the amount of paperwork, certainly it can be a huge workload. So there are a lot of parties that are involved and disciplines as well in terms of healthcare. It's not a homogeneous organization or homogeneous industry. Whether it's the technology companies, whether it's healthcare, whether it's the pharmaceutical companies, whether it's the hospital groups and organizations. And one of the main reasons why healthcare has been slow is because the landscape of healthcare is always changing. What may be true today may not be true next year or in a few months' time, as opposed to banking, which tends to be much slower in terms of certain practices or even the aviation industry. There are also differing standards between hospitals, between countries, and certain specialities. And ultimately, there's always a fear for patient safety. I mean, that remains a pivotal point as we innovate in healthcare, is that we must ensure that patient safety is well guarded. Reimbursement policies. Reimbursement policies are very different between government and private sectors. And currently in private setting, a lot of reimbursement is tied to patient visits. Hence, it pays for patients to remain unwell. Because if they remain well, they do not visit hospitals. They do not visit your doctors. If you do not visit your doctors or hospitals, you don't get paid. There's a lot of physician reluctance as well. And a lot of it is tied to medical education and training that hasn't caught up with the times. But at the same time, there's a lot of confusion. There's a lot of uncertainties, and people feel insecure when they use new technologies. And of course, patient factors. Patients will get involved if they feel comfortable with it and they are familiar with using it. And hence, even if we introduce certain technologies, we must ensure that there's adequate training for patients, doctors, as well as the administrative staff as well. I've spoken a little bit about medical education and training, which hasn't changed very much over the years. And I think that it is one of the pivotal areas to address if we are to infuse better technology and better innovative culture within healthcare. So I'm going to go through several points, and then I think we're going to open up for more discussions, because I certainly will not have the answers to this, but these are a lot of these areas which I think are extremely important to address before we ever think about having a conducive environment for innovation. And one of the main things that I believe that it must not be at the expense of patient safety. For example, there's a current rush to use telemedicine. The problem with that is we cannot, it does impair the way we deliver healthcare. It will not be the same. So the question is, as we use technology and telemedicine, will it be at the expense of patient safety, or will it have similar outcomes? So it requires a lot of research into it, as well as we collect data to determine where's the sweet spot, how much of technology should we use, and where should we use technology. So patient safety is certainly the utmost importance as we use new solutions in healthcare. And this is extremely important, I think, is breaking down traditional boundaries and barriers. And I think this COVID-19 has allowed us an opportunity to do that, whether it's between private or government setting, whether it's between different hospital organizations, whether it's between the administrators and doctors, or whether it's between different specialities, or whether it's between doctors and payers or hospital and payers. I think there are so many boundaries that are put up, or even between technology companies as well. Recently, we heard news of Apple and Google working together to develop some possible solutions for COVID-19. This is a good step in the right direction, but we do know that traditionally tech companies are very competitive, and that itself forms a boundary to some of these innovation. So we have to break down traditional boundaries if we are to create a conducive environment for innovation. And always digital transformation starts with a strategy in mind. I think it's key to know what do you want to achieve in healthcare. Then you can formulate how would you like to do it and who would you like to involve. I think if you do not have this very clearly in your mind and rushing into certain solutions or technological innovations can actually cause more confusion. It can and reduce the quality of your care as well. So it's very important to map this out in any of your organizations if you are to ensure that any plan to innovate or change or any introduction of technology will be successful in the long run. So always I say we're always very hyped up on the technology. Let's infuse telemedicine. I've been involved in some hospital groups and organizations who have suddenly introduced telemedicine, but they have not really brought everyone on board. I think it's that rush to be the first so that they be seen as at the forefront. But always I equate that to building castles on shifting sand. It will not stand the test of time because people will end up not using it, or they'll be unfamiliar and they find that the quality is severely lacking because training is and the passion of the people is not there. So it always starts with the people, the training of the people, finding the right people, putting the right people in the right places is extremely important. It's not what advanced technology that you use, although that will be important as we move along. And always, I find that there is a tendency to digitize existing workflows, and that can be actually very constraining if we are to do that, and it will potentially replicate the same errors that are currently existing. I think there is a need to rethink how we do things, how we deliver care, whether it's through continuous remote monitoring, or whether it's through e-prescription, or even through through education of the patient as well. So I think that we need to rethink how we do things, even registration of the patient as they come along. How do we ensure that this become as seamless as possible, rather than just digitizing a paper format, which can sometimes be very constraining to the organization. And I always believe that we should never, ever allow tech companies to dictate your digital strategy. A lot of times, because of the lack of expertise within the organization, there is a tendency to find the best company or solution. Unfortunately, depending on the expertise and the limitations of these technological companies, a lot of organizations would then limit themselves to what these technology companies can offer. And hence it goes back to that strategy. It's extremely important to know what you want, so that you can select and direct your strategy appropriately, and not allow tech companies to dictate what should and should not be done. And I think using the right technology at the right place, right time, it's almost cliche, but certainly it's important. It's not using the very sexy technology. Now we have artificial intelligence, we have big data, we have augmented reality. The problem is some of these technologies are there, but they're not mature enough for healthcare. Certain areas may be ripe. For example, we have seen the use of AI in reading X-rays, for example, or reading CT scans. That would be something that is doable. However, in other areas, a lot of these technologies are not ripe, and they're not ready, and therefore rolling out to the masses can be difficult and not possible. And by the time you roll them out, or it's right, it probably many years down the road. Technology it doesn't have to be new technology. It can be old technology as well. As simple as a telephone can be extremely useful in the right place, in the right scenario. And lastly, patient empowerment. I think this is extremely, at the end, it's an important aspect, and that's where the future is heading. A lot of times patients feel constrained by the environment of their healthcare providers. This lack of data sharing, doctors are not, and organization or hospitals are not really sharing their data, or giving the patient the best care. Sometimes the specialty may not be available in that hospital, and they should be referred to other hospitals, but they are not, because transferring between hospitals is something that is very difficult, and certainly fraught with a lot of bureaucracy as well, whether it's government or private. And hence, whether I think as we develop technological solutions, patients should also take more responsibility for their care, because I think if you put this responsibility on healthcare providers alone, it's going to reduce your outcomes. There is no way we do it so it's like you can't clap with one hand. And it's extremely important to include patients and empower them to take care of their own health, and also to keep their own records as well. I think there is a lot of movement and certainly continuing debate towards that. But that is, I think, important in order to ensure that data goes across different departments and hospitals and specialities. So I think there are a lot of organizations worldwide that have been involved in hacking health, and And the reason is that they're all run by a group of volunteers from different specialities as well, whether it's technology, whether it's healthcare, and basically to find solutions from the grassroots. So is to find people with passion, and because it's about believing in people and what they can bring to the table. It is not that you must learn how to code, or you must have some sort of IT level of IT literacy, but certainly everyone plays a role in innovation space, and everyone needs to be heard if we are to create that ecosystem. And this is a global organization of volunteers, which I think it's extremely good to join as well. And of course, in Malaysia, there is a group called Digital Health Malaysia, and I think they have been organizing several events, as well as they have been very important in the move to ensure that the direction that digital health makes in Malaysia is the right one, whether it's regulation or whether it's the innovation ecosystem, and assisting whether it's the government or the private sectors in moving in the right direction. So there's certainly a movement to create this innovative thinking in Malaysia, and I think that these movements should be supported. And you can always visit their websites if you'd like to contribute. Well, that's it for now.
Thank you very much.
I'll be happy to answer questions.
Yeah. Wonderful. So we're gonna go into a question round now. We've already got people using the Q&A. Please do continue to add questions to those. We're going to have a few questions from myself. We're also going to do a pop-up question to you as the attendees to understand a little bit about your thoughts on innovation. So I just want to kick this off. Malaysia's response to the crisis has been widely hailed by international communities. What were some of the key strategies that they implemented that managed to support the pandemic? Some of the really positive things that occurred?
I think one of the main success stories is the fact that a lot of actions is based on the data that they collect, and certainly also from the experience of other countries as well. And the quickness of action, I think it's extremely important in this scenario. But I think what's interesting in this COVID-19 pandemic, as opposed to, let's say, the Spanish flu in 1918, is the fact that the response, the global response, is a lot quicker. That's more flow of data between countries and shared between countries, usually via the World Health Organization. And this data has allowed people to understand how the transmission would react. And therefore, using these early models has allowed countries to predict where we would go. And because of this prediction, we were able to act appropriately and act fast as well. Of course, there are a lot of differing strategies and belief, and only time will tell whose strategy is best in the long run. Whether you would like people to have more immunity, more infections, and have a quicker resolution to the pandemic, or whether we'd like to save lives, but allow the virus to linger on a little bit longer. So the term we call flattening of the curve as well. So I think different countries have different strategies. Only time will tell. I think none of us have the right answers to that. But I think one of the main differences in this pandemic is the availability of data and the quickness of the scientific world in identifying the virus as well. So I think a lot of lessons have been learned from, in particular, SARS, but more recently, MERS as well as Ebola as well.
And thank you. what we've seen actually within the current pandemic is that there's been a massive rush to some of these new technologies, particularly in AI, big data analytics. In Malaysia, we see many of the private healthcare providers have been pivotal perhaps in that telehealth. But how do you encourage private providers to get engaged? And how do we encourage that joint ownership really of this problem to drive that forward? What's the strategy there?
So I always believe that if you are going to do something, we do it right from the outset. And I think one of the important barriers to overcome is working together as a group. It's almost like how Google and Apple work together. It's about different healthcare organizations like IHH or Pantai working with Sunway, working with Sime Darby, as they create this telemedicine infrastructure. Because if we introduce telemedicine, patients will tend to cross different treatment environments and not restrict themselves to one, because they now have the ability to communicate with their doctors. So this can complicate matters. For the last time, we used to have a little bit more barriers in terms of patients seeking treatment elsewhere. But now this will allow patients to cross between different environments. If we are just going to introduce telemedicine to our own particular subset of patients, I think it's only going to defeat the purpose, and the benefits are going to be extremely marginal. So if I have a message to private healthcare administrators, I think this is an extremely important time to offer the olive branch, because then and also have the ability to start opening up your borders as well, as we introduce telemedicine into this. And that's how we innovate and push it forward. If not, we're going to work within our bubble, and we're going to basically be chasing our tails. I always like to give the example of banking, where now bankings share data across a single platform, so we can withdraw, let's say, money from one branch and not just from another branch. So I think we need to have that understanding and that framework as well. At the same time, as we introduce technologies, hospitals need to understand that everything else needs to go in tandem as well. We can't just introduce telemedicine without a very good digital infrastructure, without a good electronic medical record, so that the records can be recorded, without the ability to capture data, whether it's remote monitoring or whether it's measuring outcomes as we go along. One of the analogies is you can't have a very advanced airplane without an advanced control tower or an advanced airport. That's not going to work. Everything needs to go in tandem. So it's not just about telemedicine. So back to the strategy, when they go into this, they need to decide, okay, we need to change. What do we want to do? Okay, we'd like to introduce telemedicine first. What's next? How do we ensure that we improve healthcare, not just introduce a avenue that may just offer very minimal benefit. And I always tell people telemedicine and video conferencing is just a telephone call on steroids.
Thank you. So just one more question before we go to our poll online. And this comes from Yan P on the questions and answers. But what were some of the most beneficial novel workflows that you describe made possible by the digital platforms in healthcare? Which ones would you highlight?
Well, that's a lot, but always going back to the patient journey as well. I think when we develop this, we want to ensure that the patient journey is as seamless as possible, and this is some of the experience we get from other industries as well. So be it patient having a control of their own appointments, about easier registration process, about access to their doctors, and about even assessing their lab results or their X-rays or radiological reports, and of course, what's the future plan? We do know that some hospitals in the States have, or some hospitals even within this region have their own apps, for example. And every patient that comes in will then download this app, which allows them to have information at their fingertips. And I think this will change the way patients actually move within our hospitals as well. We may actually find that a lot of movement is unnecessary, and I do know that some of these apps even can direct them to the right place without if you do not have someone to ask around. So it makes their trip as efficient, or even also avoid crowds in certain areas if they are detected. So it can manage the environment within the hospital, but also at the same time keep patients outside the hospital if necessary. So I think they need to infuse the ability for doctors to remotely monitor. But having said that, of course, the ability also to provide important data at the right time to doctors. So as I get involved in telemedicine, I've been doing that over the last couple of years, you realize that as you go along, you pick up patients. And the more patients use telemedicine, you realize that the more time it takes, and the more stress you get, because when you offer patients a service, the expectations are going to be a lot higher as well. And at the same time, there is a possibility of creating more errors. One example is sometimes when there's a conversation online and they're not recorded in the patient notes, and when the patient do come in, some of these conversations are not captured. Or when the patient sees another doctor, my online conversation is not captured, and the essence is lost. So there's actually a lot of things that we need to do, but I think it's doing it in an incremental manner. Some low-hanging fruits are like the appointment system, and certainly telemedicine and remote monitoring. But I think we need to work how we would like to change, and it has to be very specialty specific. What surgeons would do would be different from what ophthalmologists would do, or what general physicians will do. So it has to be drawn in that sense, and not a blanket, this is a workflow for everyone, go for it.
Thank you. Yeah.
I think that's not going to work.
No, thank you very much. We're going to jump straight to our poll. We're asking you a question, should pop up on your screen any second, I hope. Yep, there we go. Which area of healthcare should be the focus of digitization and innovation? 3 choices for you here. If you just have a look, read through those and perhaps put them in. We're going to give you about 45 seconds to put in your answer as the most appropriate. In the meantime, we are still capturing questions as they come in. I hope to get to those shortly. Be asking Dr. Benjamin. We're going to have to shrink our answers slightly to get some more in for this next section so that we can finish on time. And one of the questions as we just finished that poll was there's a reluctance to adopt telemedicine due to Telemedicine Act in 1997. However, the NHS switched to video consultations very early on in this pandemic. And why do you think the worlds are suddenly so different? That comes from Mo Pintan on the question box. So just before you answer that, we're going to close the poll now. Thank you very much for your answers. And we're going to show the results of the poll. Hopefully it will pop up. So we're going highest percentage, deliver healthcare remotely, reducing costs and improving patient outcome and patient experience. So very timely in terms of that question. Then, why we've driven so quickly to video consultations. Perhaps I can pass back to you.
I think to that question is probably all the above in tandem at the same time. I think that would be the gist of why the percentages are quite even across the three answers.
Yeah.
All right. Yeah. Hi, Mopin. So I think, I think regulations in Malaysia has always been extremely slow, and I don't think the Ministry of Health has always been very quick in terms of creating new rules or laws, and it's always been business as usual for quite some time. And the Telemedicine Act also in 1997, I think it's already quite archaic, and I understand that is in the process of changing, and will definitely change as well. But you're quite right. A lot of countries have moved early and have recognized the need and the benefits of video consultations, and a lot of lessons have been learned as well. And I think if you ask why do you think our worlds are so different, that's I think a matter also of funding, the culture of research, the culture of innovation, and the way the education system goes has built a different society and community between what's happening in the UK and Malaysia, and I think that has driven a lot of that differences. But I think this COVID-19 hopefully will spur a new revolution, as I would say, of people who are passionate enough to change things.
Thank you. And I think Gordon Pang's question again was, do you think the pandemic provided a good opportunity to establish teleclinic as a way moving forward? And I think we can see some real benefits of that. One of the questions actually is quite interesting, Shri Patil, I think it is, how to involve such innovative processes as a student. How do they get involved in innovation?
Well, so it's a very important, I think, question, and it always starts with education, and it starts as low as even preschool and under and primary as well as secondary education. And to me, that is actually very important. In my time in the university, I realized that sometimes universities are being expected to change people after just in a matter of few years, after many years of rote learning and very archaic methods of education. And therefore, I feel that the entire education and the way we instill certain values has to change. Having said that, I think right now there's a lot of things that universities and certainly students can do. The question always is, what's the focus of the university? There are different types of universities for sure. Some universities are likely not going to be very supportive of your innovative venture, whereas others, in particular research-based universities, will certainly be more open. And I think there's a lot of work between universities, so students can always find projects and bring forth your project ideas as well. I think there's growing, hopefully, research funding and a focus that we really need to pour into research as well. So a lot of what we do, whether it's telemedicine, a lot of protocols are based on existing research on what works, what doesn't work, even in how we deliver care in different diseases, because it's very the workflows and everything is very specific. The training is very specific with someone with cancer, for example, or an elderly patient, or even someone with rheumatoid arthritis. So there is a lot of areas where you can certainly work on. I think you do speak to your universities, and it's a difficult question to answer because it depends on where your environment is. But I know that it's been very restrictive in Malaysia, as opposed to some countries where funding can be larger. But you can always start with very simple projects, which doesn't require extreme amount of funding. But there are a lot of groups that you can join these days. You can search them out as well, and certainly share your passion and your ideas.
Thank you. So based, one of the major questions is, will healthcare ever be the same again post-COVID-19? And, based on your Hacking Health experience, will we start to see more innovations, collaborative model between healthcare, private, public partnerships? Do you think we'll see sharing of data across countries, territories, Singapore, Malaysia, for example, as Natasha asked in our questions there? Do you think it will be the same again? Will we go back to normal?
Well, I think some things will remain the same, but there will be a lot of changes in several aspects of healthcare. It's a very tough question to answer whether different countries will be able to share technologies and data. And Malaysia and Singapore are extremely bad examples. We may be neighbors, but I think a lot of instances we may be poles apart as well. But yes, it's certainly, I think if anything, COVID has taught us that we do not live in a bubble within a country, and we cannot function independently alone. And we are stronger if we collaborate with other countries. And I always believe that at least within Southeast Asia, there's such a huge potential for collaboration, whether it's Malaysia or Singapore or Indonesia, or with Philippines or even Thailand as well, or Vietnam. There's so many things, so much things that we can actually learn from them. Are there any plans for countries to share technologies? Well, I think that's a bit beyond us, but I think there is a need for people to break down that barrier. And that requires a little bit of sometimes political will as well.
Yeah, and I think just reflecting on Joey Gann's question around the patient engagement, I think you emphasize that the patient has to be at the center of this, has to be engaged with this. There are challenges in getting patients to pay for applications, pay for access. Should this be government-led? Should we be driving this from a center, or should we be getting patients to empower their own healthcare? Which direction do you think it needs to go?
Well, I think every level is extremely important, whether it's from the doctors themselves or whether it's from the hospital administrators. I think it's going to be a very gradual increment. I do not expect that we can change people's mindset overnight. A lot of times it requires a drastic revolution or change, and I think that's why the conversation with COVID-19 is it has allowed people to be more receptive. And if we strike when the iron is hot, we can actually have patients to be more receptive. So based back on my experience when I use telemedicine, I can tell you 90% of our patients are extremely receptive and surprised that this is being provided. And I think they're all appreciative of that as well. So there's always been a need for patients to maintain some control over their care. But over the years, that control has been removed from them, whether it's because the health facilities and the environment actually disempowers them. And they are literally at the mercy of the doctor, even to shift care or to seek additional advice, and sometimes we met with a lot of resistance from doctors as well, whether it's because if they are busy in public practice, or whether in private practice there's a lot of these restrictions. So I think that will change slowly, and hopefully there will be new solutions. And I always give the example of Grab, where it literally empowers riders rather the passengers rather than the providers themselves. So I think giving patients the responsibility, whether it's remote appointments, whether they control their own appointments or they monitor their own blood pressure through all these IoT devices, giving them a specific target, I think would be important.
Thank you very much. Really great to have this opportunity to talk. Real pleasure to spend some time with you and ask these questions. Thank you very much for the people who were involved in the questions and answers. Sorry that we didn't have a chance to answer all of those at this time. We're going to be doing this again next week. I'll get it right this time. We're going to be meeting with Professor Guillaume Rebello from Brazil, moving to the other side of the world. Digital transformation innovation in times of COVID-19. Please reserve your space. Come and join us on that talk, and we will be publishing this copy of this recording up to the website in the future. Thank you very much for your time. All the best.